This is Lynn Schrader here in beautiful West Des Moines, Iowa, and this is our PPACA updates for agents. So thanks for joining us this morning. And I've got an agenda put together as I normally do. We're going to talk about the critical dates. We're going to talk about a couple of Medicare Part D things. Even though we call this healthcare reform, I tried to slip in a couple other things that are pertinent to what's going on right at the time. We're going to talk a little bit about the marketplace, both individual and shop, and what's going on there. We're going to talk a little bit about, thanks to our partner, Advantage Administrators, we're going to talk about the dangers of premium reimbursements. And we know that as we're meeting with group clients, many of them are trying to do things that could get them into trouble with the IRS. So we're going to talk a little bit about that. We're going to talk a little bit about small group rates, some training topics, and then I've just got a slide that labeled miscellaneous. So we're going to move ahead here. So let's talk about some critical dates, because as you guys know, here we are. We're coming down to the end of, the last day to submit both under 65 applications as well as changes. And this is where a lot of people are confused in the under 65 market. You know, this is not just for new enrollees. We know this, but it's also for people making changes. So just a reminder, December 15th is Monday. Now, I don't know about you guys, but, you may be working this weekend. I mean, that's just kind of what happens. And I know a lot of you ended up working a lot weekends and evenings on that Medicare open enrollment too. That's over right now. So so knowing that the last day is December 15th on Monday. So please, if you need assistance from us, call our office. But you've got to get all this stuff submitted by end of business on the 15th. And then of course January 10th is another key date. As you know, Wellmark has opened up the agent of record process. For both, we've always had it in the group side, but now it's open for individuals. And I hope many of you, as you work through, if you were in your Medicare open enrollment for the Part D and Med Advantage, I hope many of you that maybe you were helping somebody and you don't have their supplement. I hope you were talking to them about that and talking to them about signing an agent of record form. Remember that you can get those in to us, and you can get them in any time. Just we don't want a date on it, honestly, but preferably just hang on to it until January 1st. You're probably not working that day. I hope you're not. As we ring in the new year, just know that shortly after that, anytime after that, prior to January 10th, send KHI your agent of record changes, and we'll get those sent in to Wellmark. We will get them in. Whatever we have, we'll get them in by January 10th. That'll give you a 2/1 effective date. And that's the soonest that you can start to get paid for these policies. I was going to say the soonest you can start servicing it, but we know many of you have been servicing these policies for years. So just don't forget about that. And then, of course, if you miss January 10th and we get it in after that, then it'll go into effect on March 1st. So it's always the 10th of the month, and it'll be effective then the 1st of the following month. So get them into us so we can help you track them. If you send them in by yourself, we don't know about it. We can't help you track and push for the proper effective date. Okay? And then, of course, January 15th and February 15th. Those are two other key dates that are coming up. And that's why what we predict is after December 15th, you guys are going to have a little bit of a lull. You're going to take a little deep breath, because you're going to get somebody to come to you on the 16th and go, hi, I want to change my my policy. And they're an ACA policy, they're a grandmother policy, and they want to change or they want to look. You can do that. That's fine. But help them understand this now will be a February 1st effective date, not January 1st, because past December 15th, they've missed the opportunity to get a 1/1. And that's important for a lot of people. Some of them don't realize that. But anyway, make sure that you know that. And then after December 15th, everything then would be a February 1st. Of course, after January 15th, now you're in that limbo again, and you can submit. But after January 15th, you're going to get a March 1st effective date, all the way up until February 15th, right? Then you can get a 3/1 effective date. But again, not only new, but also changes. And I say that with a caveat. Of course, right there at the end, I talk about without a special enrollment period. Remember, that's the only other time they'll be able to change. And I think some people a little bit start to freak out because they're like, well, I'm going to retire early, or I'm going to do that in June. It's like, but that's a qualifying event. That's okay to do. So anyway, so we know about the special enrollment period, and loss of employer coverage would give them a special enrollment period, as with all the other things we've talked about, changes in the family status, such as married or having a baby and that type of thing. So again, I want to stress changes as well, changes to a policy. And I'm going to mention it now, but I mentioned it at the end as a reminder, and Brenda caught this, and it's awesome because I pushed this out to Brenda and said, hey, can you think of anything else I should make sure I update the agent staff on, the agent team? And she said, have them, don't forget that if you're dealing with ACA customers right now, that you can split contracts. So let's say that this, let's say just a spouse has come to you. So you got two on a contract, they're spouses, and they come to you and go, holy cow, you know, we got this huge rate increase, what are we going to do? And one of them might have some health concerns and the other one might not. And you can today, in this day and age now, you can split contracts with all the carriers. So I could put Dad, and if I wanted to stay with Co-Opportunity or Wellmark or Coventry, any of the carriers, I could put Dad on a high deductible plan, and I could have Mom on a copay plan. And when you do the crunch the numbers on that, when you look at the out-of-pocket maximums, remember, especially for a two-person family, many of the deductibles and the out-of-pocket maxes are 2 times. So if you can split the husband and wife off or the spouses off, then all of a sudden they've got the single deductibles and single out-of-pocket max, which usually they're not hurt on, and sometimes they can even benefit based on the plan they buy. So just remember that, and I just wanted to comment because you can split ACA plans. You cannot split grandmothered plans. So if you've got somebody that hasn't moved to ACA yet, and they're thinking, well, we want to take Dad off and put him on an HSA, can't do it. If you take Dad off, you're losing ACA status for the rest of the family. So I'm talking ACA only, and I mentioned that at the end again, but I say that because, you guys, this is the time to do that, and if we miss this, we can't make those changes for people. I'll say this for 1-1. You can make it then 2-1, and you can make it 3-1, okay, and then we're done. So you've got a little bit of time here for those splitting of the contracts. It just can't be effective 1-1 if you don't get it done by December 15th. Again, unless there's a qualifying event. Okay, lots to that, and we'll open that up, obviously, to conversation as we move forward. So now let's talk about, and thank you, Frank Olson, because Frank goes, Lynn, make sure you add this to your presentation this month. And this has to do with Blue Cross's, the Medicare Blue program, which is Blue Cross, getting the 5-star rating. And, you know, a lot of times they're like, 5-star, well, that's really nice, and that's good, right? And our clients love to see that, right? Oh, it's a 5-star plan. I know, Blue Cross does a great job. But what does that really get them? It allows them to enroll in one of those Medicare Blue plans all year long. So it's kind of crazy in that if somebody came to you now, because we're after December 7th, we're no longer in the Medicare Advantage, Medicare Part D open enrollment period. Now, we're coming up on the Medicare Advantage disenrollment period, and I'll talk about that in just a second, but literally from December 7th, right now, if you get somebody enrolled by December 31st, they can have a 1/1/2015 effective date, but they have to go to Blue Cross. They can't go to any other carrier because nobody else that I'm aware of, unless you guys know, nobody else got a 5-star rating. So it allows people to enroll in their plan all year long, and we verified with Wellmark that between December 7th and December 31st, if you miss getting to all your people, especially your Blue Cross people, but anybody else that might want a Blue Cross plan, you've still got time to get them a 1/1 effective date, okay? So that's a big one. Now let's talk about the Medicare Advantage disenrollment period. You know, I had not heard a lot about this. In fact, I was talking to another agent yesterday, and I was like, gosh, I don't even really remember hearing much about it. I don't even remember this being on any of our training. I really don't. Now, maybe I just blew through it and I didn't pay attention, but there is a disenrollment period from January 1st through February 15th coming up in 2015. So what does that mean? Yeah, somebody that has a Medicare Advantage plan, and maybe they were, maybe they were hit with some illness or something like that. They want to get out of their Medicare Advantage plan and come back to original Medicare and buy a supplement. Well, it's not the supplement that's the issue. Remember, they have to answer health questions to get a supplement. That's always been true if they're outside of their open enrollment, right? So if they can answer the health questions during this Medicare Advantage disenrollment period, January 1st through February 14th, that gives them a special enrollment period to buy their Part D from any carrier, right? So disenroll from any carrier between those times on a Medicare Advantage. If you can answer the health questions, you can sell them a Medicare supplement policy, and sell them a Part D using the special enrollment period. Great. But what happens now if somebody wants to disenroll from Medicare Advantage and it's after January 1 through February 14th? Can they? Well, they can certainly drop their Medicare Advantage. They can actually cancel their policy anytime. But the issue is they can't get a Part D anytime. And, of course, if you go without and you're eligible, now you're going to pay a penalty someday, right, if you ever get your D back again. So generally, people want prescription drug coverage. So remember, if a Medicare Advantage plan chooses to disenroll outside of the disenrollment period, their only option then is to get a Blue Cross Part D. At least it's better than nothing, right? Because we didn't have this last year. They didn't earn the 5-star plan in 2014. So this is or however they give it to them, we're able to do this now for the 2015 plans, which is really exciting. Okay? So I wanted to make sure that you understood that. It's huge, especially for those of you that have a nice sizable block of Part D well-marked clients, and you might not have been able to get to all of them, and they're pretty committed to Blue Cross, and especially to move them from that standard plan down to the Value Plus plan. It's like, oh my goodness, you know, the deductibles cut in half, the premiums, you know, drops by $20 a month. If you've got standard people, unless there's something on that formulary that's keeping them there, you really want to get them moved. You can do it. You've got time to do it, and they'll be happy with you for that, okay? All right. You know, a month ago when we had this call, we were all like, okay, we're gearing up. It was November 11th, and we were gearing up for November 15th, and we were saying, okay, they've got the websites fixed. Everything should go really smooth. They're going to move those searching for plans to the front, so you don't have to create an account just to shop for plans and get rates. And so I think it started going maybe okay. And what we're finding now is there's trouble again. I've talked to many of you. You're actually beginning to panic because this is, if that client is committed to a 1/1 effective date and they've got to have it, and you're trying to get people onto the marketplace and get them their subsidies, or here's a kicker, there's been a rate increase, right, on the marketplace, and you've got to go back in there and re-clarify, if you will, their subsidy. Go back in there, confirm their income so that they can have an updated subsidy applied, not just the subsidy that they might have had in the past. So I've talked to many of you saying there's issues, Lynn. Passwords are an issue. Verification is an issue. It's just kicking people out, and all of a sudden, and it happened to me. I did it myself yesterday just to see what was happening, and I got the little notice that said, hey, we want to help you, but you got to come back later. The website wasn't available, and I already had clicked in it, and I was in it, and then I was clicking for the verification. So when you notice here, whether it's the individual marketplace, which, again, all of this is found at healthcare.gov, if I go to the individual marketplace or I click right at that top that I want small group, for that, if I'm looking at the small group, then I want to make sure that I'm going through here. I just saw a call come in from Carol, and I want to make sure. Shoot me a text, Carol, if there's something you need to communicate to me while I'm on the conference call here. But anyway, going to healthcare.gov, you know, you've got to be able to go online for validation of their subsidy and for the shop marketplace. And here's where it gets really interesting. So remember last year when the shop was really, I'll say worthless, because the shop would not enroll people online. So what you had to do last year was very simple, actually, and I helped several agents do it, so I know how simple it was. You'd go on to the website with your employer group, and they get their validation saying you qualify for the premium tax credit, right? This subsidy rather that you're going to get here. Print this form out, take this form to your CPA, done. Now go enroll with your broker directly to the carrier. Piece of cake. This year, guess what, right? They are requiring, if you want that shop, if you want that subsidy rather, that tax credit, that little form that you take to your CPA, you have to enroll online. And many employers are going, what? Because their agent or broker made it very simple for them last year. All they got was their validation form, right? Verification that yes, you qualify. And so anyway, goodness sakes. And now employers, with your help, right, are trying to figure this out, and they're on there because they're supposed to set up their account, and you can help them, but there's some verification that they need to put in there that only they can do, verifying who they are as a company. And so then we have to enroll the people. And they can do it manually. You can upload it, but still, it's just we're having issues. And just know that if you have a company that you think you're all squared away with, that you sold them a co-op plan last year, and I already heard from Amber, so Amber, I know you and I are going to talk this probably after the call, but there's just issues. Let's just get it out there, right? And some of these companies may not get the credit, is all I can say, because we'll have to go directly to Co-Opportunity to make sure we can get them enrolled, because we only have till Monday. So we're coming down to crunch time here, and it's ugly, and we know this. And so I know, that's why I said many of us I know are going to be working this weekend and working, of course, crazy late hours and working like crazy on Monday. So, by the way, Co-Opportunity also says if you have a shop plan that you had with them last year and you're trying to work with them in the marketplace, they want to know. So make sure that you're in touch with our office so that we got your backside, right? So we can make sure that Co-Opportunity knows the issues that we're having, that this is still going to be a shop plan, but we're having trouble with the website. Okay. So after all that, let me take a drink. I get a little fired up about all that. It's just water. Okay. So the next slide I do want to go through, just so it's documented, it's here on the screen. We can push this out to you if you need it. Normally we get these presentations posted. Usually we get them done over the weekend or shortly thereafter on Monday. So by next week this presentation will be out on the website. But for many of you, for some of this information, that would be too late. So if you need this presentation or this information, just send me an email right after this call, and I'll go ahead and send this to you so you've got it. So what I want to, this is some of the information that we've been sending out to agents about how to do this. So this is the step-by-step for your employer if they want that tax credit. So that's just what you do, and I won't go through it. You can read it on there. If you need this, you holler at me, or if you haven't seen this, I know Tricia had sent this out to several agents. You can shoot me an email, shoot Tricia an email, and we'll get this pushed out to you. So yeah, this is it's a little crazy this year. And I think the other challenge is that here in Iowa, we're not using the shop like it's intended to be used. Because now I think somebody said there might be a couple other on there that I was told by the insurance commissioner that there are no other plans on this shop. Now maybe I was outdated. That was probably 6 weeks ago when Commissioner Gerhardt had said that to me, because I asked and we were hoping there'd be more competition. But as far as I know, it was Co-Opportunity is still the only group player on the shop. So kind of the point was, why go there and shop? Because the whole idea, besides getting the tax credit, the whole idea was to have employees have options so that you could say, okay, everybody out there, you can go to my employees, go get a silver plan. I'm blessing you to go get a silver plan, and I'm using maybe defined contribution, so I can say, I'm giving you X number of dollars, go find a silver plan. And then the employees can all go out to the marketplace and find any silver plan out there and buy it. So that's kind of cool, because then the employer's not saying you can have to pick from this 1 or 2 or 3 plans, whatever, right? So they can pick from whatever. But again, it's kind of a moot point because Co-Opportunity is the only carrier on the shop marketplace this year. So anyway, it's yeah, hopefully better things to come ahead. But yeah, if you need more help on that, certainly get a hold of me, get a hold of Tricia, call into the office. We'll see what we can do to help. Okay, let me keep going here. Okay, so now let's talk about the dangers of premium reimbursements. And I know we've preached this before, but for some reason employers want to be a little stubborn and want to insist that their TPA is telling them that it's okay, they can continue to reimburse their people and not offer a group plan. They can reimburse and tell people go get your own individual policy, even with a health reimbursement account. And it is absolutely not true. They cannot reimburse individual policies, period. And you'll notice right here in terms of the IRS, and this came thank you to our fantastic TPA partner in Advantage Administrators. Dietrich Drenko does such a fantastic job, and if you need help, you got to get a hold of Dietrich. Our office can help you get a hold of him if you're not sure how to get him. Advantage Administrators is his company. Google search him. They're out of Waverly. You'll find them. But we got this from them, and they just do a terrific job of making sure that they're keeping us compliant as well as keeping your clients compliant, because I think they look to you for that, right? So please know and check out the fee, the penalty, up to $100 or including a $100 per day per employee penalty for these reimbursements. So anyway, just make sure you know that. And then we've had agents that are out there that seem to think this is okay. And I'm telling all my KHI agents this is not okay. And make sure your E&O is up to speed if you think you're going to go ahead and talk about this as being okay to do. Okay? So we've got more on this. I'm telling you, if you Google, you go out to HR Solutions on the KHI site. If you don't have your login for that, again, get a hold of our office. But that's been a tremendous amount of help for agents that want to know, how do I get this? I want to copy this and send this. So you can get it from Healthcare Reform. You can get it directly from Advantage Administrators as well. And so anyway, it's important. Okay, so now talking about small group rates. So I want to, this is maybe a little tactical, if you will, but I want to share a little about the Affordable Care Act, but then also just how are you positioning yourself with your small business employer in the market. So, so how do you advise them, right? So I was working with an agent on a case just this last month, and they're really struggling about it. Let's cover the Affordable Care Act piece first. We know now that in 2015, the affordability definition for anyone, right, offering to see if your plan is affordable is 9.56% of their adjusted gross income of that employee. Now remember, if we're a small group, we're 1 to 50, right? We do. I'll say, yeah, 1 to 50, the way we rate, right? And we don't have to offer coverage. Remember, 50 and above now, you have to offer coverage or pay the penalty. We know all that. But still, this affordability guideline is a good guide for even small businesses under 50 that don't have to offer coverage but want to. So remember, it's 9.56 for them to do their little check to make sure that they're providing an affordable plan, affordable in quotes, right? So then we talk about, now we'll go into just a little bit of how you help that employer. Defined contribution, is that what they're going to do? I'm just going to give every employee $400 a month. And now you can go buy your health care, you can buy some of the ancillary products, voluntary products, etc. Or they're talking about a percent of premium, possibly with a cap. So we'll pay, 75% of your premium up to a certain dollar amount. And why is that important to have perhaps a cap? That would be because many times you're going to have that 63-year-old on that group plan, that 64-year-old, that 65-year-old. You're going to see these folks, and their premiums are going to be $700 a month, depending on the plan, of course. But holy cow. So if an employer is paying 75% of somebody that has a $700 premium, and they're paying 75% of somebody that has a 19 or 20-year-old with a, and I saw this one, it was a 19-year-old employee of this plan with a $163 premium. So, because guess what? He's in that 0 to 20 age band, right? When you hit 21 and above, then you go to, it's all kind of adult rating now, but goodness sakes, for 100, how do you do that? So, is that fair? Is that right? But also the employer is paying a heck of a lot more. 75% of 700 is a heck of a lot more than maybe some kind of a composite number or an average, right? So then you might look at all your employees and what the insurance companies used to do for us in the small group market, composite rating, right? Now the employer ends up doing the composite rating, adding up all of the rates for employee only, for example, of all their employees, and dividing by the number and coming out with an average for all employees. So just kind of food for thought here as you think through. My goal at these conference calls are always, hopefully you walk away with something new. Maybe you knew it, but it was a reminder. Maybe you knew it, but it was a different way to think about it as you continue to add value to your clients. So let's look at two-way rates versus four-way rates. Does it really matter anymore? Everything in this market, remember, is all individual member level rating. It's just asked, what about your date of birth? Where do you live? And as you know, in the group market, most employer groups now have gone away from asking the tobacco question. That's still alive and well in the individual market. But so really, when you think about it, does it really matter as an employer? Do I have to have employee only, employee spouse, employee children, and family? Well, what I find so interesting about this is it may matter, especially for many of you that are starting to see small businesses move from grandmothered status to the Affordable Care Act plans. And what would be one reason why they might do that? Well, I can tell you right now, in talking to several agents, the reason that many employer groups want to do that is because they want to offer a qualified high deductible health plan, and they don't offer it today. Maybe they weren't even big enough. Remember all those groups that were under 10? They couldn't even offer dual options. They couldn't. All they could offer is one plan choice, right? With the Affordable Care Act now, some carriers are allowing you up to 3 plans you can offer your employees, and you're under 10 people. That's awesome, right? But okay, so that's fine. And maybe if you're now offering a dual option, you've never had 4-way rates. You always had employee family. So you may not even need to talk about 4-way rates. But you talk to that small group that's had 20, 25 employees, 30 employees, 40 employees, they've had 4-way rate structure. And to look at them going away from that and having member-only rating, again, when each employer looks at their demographics, and this is what we found out with a couple agents I was working with, these 4-way, they've got to figure out a way to transition into the ACA and maintain 4-way rates, because they're looking at what they used to pay. Right? The employees are all going like, what did I used to pay? What did I pay in 2014? What's my spouse paying? Do they have coverage at their employer? Can they go get? They're going through all these, I'll call it the mathematical gymnastics, right, to figure out what's going to be better for them. This is the employee I'm talking about. So if the employer is in touch with their demographic and understanding of their employees and trying to transition them to the new Affordable Care Act plan and some rate increases, because we're seeing it, right, you have to kind of figure that out. So anyway, I've had some great experience in helping agents with that. If you need some help with that, again, we're coming down to the end here for 1/1s. But of course, you know, there are people that have other renewal dates, and not as many, of course, but let me know if you want some help with that. So I always say, and I do as I wrap up any of my healthcare reform presentations that I give out in the marketplace, by the way, I am presenting again for SHRM, the SHRM meeting in Ames. So if you're in that area or you're a member of SHRM in that area in Ames and surrounding areas, I am presenting on January 8th. Their meeting is in the morning, and I've got details on that. If you're in that area and want to pop in on that meeting, preferably you're a member of SHRM or one of your employee groups is a member of SHRM. But just know that I'm speaking there. So my point is, at the end of all my, whether I'm presenting to SHRM or I'm presenting to you guys or presenting to another group of employers, I always say, how are you leveraging the Affordable Care Act and healthcare benefits in general to attract and retain good people? So really, that in the end, that's still where the rubber meets the road, and that's just my conviction. So that's getting a little bit of Lynn opinion, but I don't think it's far off. So again, hopefully you're picking up some ideas or some things that you can use. All right, so now let's talk about training. The training that I know is coming up right now for Co-Opportunity Health, I'm going to comment on Co-Opportunity, I'm going to comment on Wellmark, and then I am interested in any struggles you might be having. I've looked at the Coventry as well, and it's super simple on the individual market. Quoting on the individual market for Coventry is super simple. If you need help with that, let me know. But with Co-Opportunity and with Wellmark, I have to say there's some caveats to it. You know, do I click there, and where's the pull-down menu for this, and how do I do a comparison, and then how do I send it to them to actually look at? So if you're curious and want to know more about Co-Opportunity Health, either newly appointed agents or you just need a refresher, I went ahead and enrolled because I want to hear what they have to say. Tuesday, December 16th. It came out in the recent Co-Opportunity briefing, so if you missed it and you need that link, just give our office a call. Otherwise, it's coming up already next week. And yeah, I think that's right. Tuesday is December 16th because, yeah, Monday's the 15th. So from 10:30 to 11:30 in the morning, how to quote and enroll. And so a lot of folks are concerned or worried about that, confused about that. And remember, we'll still be able to sell this stuff throughout the year with special enrollment periods, but we still have time clear until February 15th. So just know that and get enrolled, get that link, and get enrolled if you need to. Now, I'm not going to go to the next slide because I don't have a slide on this, but Wellmark has promised us some recorded webinars. As soon as we get our hands on those, we're going to get them and we'll post them on our website, but recorded webinars on how to do quoting on their system. Because sometimes I have just as many issues with Wellmark, and I'll tell you something else, your browser makes a difference. Some of the things to do with your computer make a difference. Like I know when I use Google Chrome, when I'm using Wellmark, it doesn't like it. I can't see all the menu choices. I have to use Internet Explorer. Then I can see the choices, the different tabs, because I can't even when I'm looking, I was trying to help an agent with a MedSup app, and I'm like, for Pete's sake, if you use anything but Internet Explorer, you don't see the county options, and you can't move forward. So just little things like that. But Wellmark is going to offer then this training on a recorded webinar, and like I said, as soon as we get it, we'll let you guys know. In fact, I was talking to Lindsay this morning about putting together a news flash. We tried to hold back on pushing out too many emails. You guys said, holy cow, you're pushing out too many emails. But if we don't push it out, then it doesn't end up on our blog, on our website. So so bear with us. But I was talking to Lindsay about pushing out a kind of a news flash to everybody, an email blast that says, you know, training. And it would give you the options for how you can go, where you can go and find these webinars for training at your leisure, at your time, right? And so maybe over the holidays you'll have time as things kind of slow down, because I really do anticipate things are going to slow down a little bit after the 15th, and then it's going to pick back up again probably after the holidays until we hit that January 15th again. It's going to get crazy. And then after that it'll slow down a little bit perhaps until we get slammed again in February, until February 15th. So. Okay, so that's just a little training update. And now I've got a couple slides on some miscellaneous tips and comments. And so the first one, I found out helping an agent again. We're on the phone together, and it was like, and unless they fixed this, and somebody can correct me if they have, but if you see this, I want to give you this heads up. So here's the deal. So an agent says, Lynn, somebody lost coverage off their group, and they want to get coverage. And the date we were working on this was November 20th. Just go with me on this, right? And they want a December 1st effective date. And they can. They are due the December 1st effective date because they lost group coverage. They're going to lose group coverage rather on November 30th, and they want coverage. And so we go on there, and I go, sure, it's simply. Let me show you how you do that. And I was going in there, and we're in annual enrollment period right now, right? We're in the annual enrollment period time. So there's no SEP, you know, really necessary, but is there? Because we were trying to get a December 1st effective date, but guess what? Because it was past November 15th, well, I should even say you couldn't get a 12-1 anyway, but that's just it. We were open to quoting November 15th. We could get quotes, but it wouldn't give me a 12-1 effective date. The same thing is going to happen if we're past November 15th, and I'm trying to get a 1-1, and I'm trying to quote, and it's trying to give me, I mean, it won't give me. I could enroll somebody, but it's going to give me a 2-1 effective date, but I need a 1-1 effective date. So when we called into Co-Opportunity, and they said, oh, man, we're trying to get a fix into our system because it's just this weird thing now. This is our first annual enrollment period with special enrollment periods that are happening, and so they need to be able to allow for that first of the month following effective date. So right now, if it doesn't give you the right effective date and you got frustrated like me and another agent did, what we learned was you've got to drop it to paper, which, oh boy. I don't know about you guys, but I try to avoid paper like crazy because I just want to have it done and in. But if somebody needs an effective date and on the Co-Opportunity website and you're not getting it, you need to drop that application to paper. Now, again, if you're on the marketplace, it's probably accommodating you for that. I haven't gone that route. This was somebody that didn't need a subsidy, and they were just trying to get their policy through Co-Opportunity. So it was off the market. So if you're on the market, I would assume the healthcare.gov will say, hey, you're getting a special enrollment then, obviously. What is it? Why are you doing this now? So you'd be able to click it, okay? So that was that just odd thing to do with trying to get a special enrollment period during the annual election period or annual enrollment period on the Co-Opportunity website. I haven't checked on Wellmarks to see if they have the same issue, so if somebody else has seen that, let's share that during the Q&A time at the end. Okay, make sure you know this, the flexible spending accounts in 2015 were increased by a whopping, and I mean whopping, $50, right? So, wow, if you remember in the past, FSA limits used to be a lot higher. I think they were around 5,000. Then they got ratcheted down to 2,500 in ACA law, and now it's going to be, it's going to go back to like having that tied to either the consumer price index or a cost of living adjustment. There's some measurement that they're going to ratchet that up with, like they do all the other HSA numbers, and they even did it, as I said earlier, to the affordability definition and ratcheted that up as well to keep up with inflation. So now FSA goes to $25.50. Remember too, let me just say this on flexible spending accounts, if you get a qualified high deductible health plan and sign up for a health savings account, which makes sense, right? You cannot have a flexible spending account unless it's a limited FSA to be able to spend on dental or vision only. And Dietrich does a fantastic job of explaining that. If you have a client who's using some other TPA, I'm telling you guys, Dietrich will bring you so much value, and the folks at Advantage Administrators, the whole team, but he'll go out on site with you. They'll bring you so much value to help you convert that client over and help them understand the new guidelines and the big C. Keep them compliant. The big C is so important. And we've uncovered several, and Dietrich can give you some horror stories about some employee groups. Employer groups, not only are they doing some of that reimbursement they shouldn't be doing, but they weren't aware of this whole issue about FSAs and if they allow their employees to sign up for FSAs and they've got an HSA, again, it has to be a limited FSA, then you can have that HSA, and that's kind of cool. Dietrich was given the example, if somebody's going to have LASIK surgery or some big oral surgery coming up, what a great way to really get, I'll call it a double hit. You can still put, if you have an HSA, you can have a limited flexible spending account and put up to $25.50 in there and have that limited though only for, and maybe that was for my LASIK or for my oral surgery I'm going to be having, okay? So good tips there, and thanks again to Dietrich for offering that. I couldn't believe this next one. HHS considering the new ACA annual enrollment dates, October 1st to December 15th. They're considering this. You guys, now more than ever, is it important to be a member of the health underwriters or NAIFA or both, like KHI is, to make sure that we're in touch with our elected officials to say, what? Now, their logic was, it's confusing for the consumer to have these dates out there, to go beyond January 1. I would tend to disagree, and as you guys, obviously, maybe a little self-serving here, but how are we trying to do all the Medicare open enrollment stuff and get small groups enrolled, because darn near everybody's at a 12-1 or 1-1, and do ACA enrollment and cram all of that in prior to the end of the year? I think at least we felt in serving and supporting you guys, we had a little bit of a reprieve so that we can get done with Medicare and get those groups enrolled and December 15th for those 1-1s on the individual, and then take a deep breath. We've still got time to work with everybody else and move them. Just move them effective 2-1 or 3-1. So I'm just saying, let's make sure that we give feedback to our elected representatives. If you're not involved in Day on the Hill, if you're not involved, I know Jess and Marcy and Eric and I go to those HHS conference calls. We got to be giving that information to these folks at HHS and to make sure they're hearing it from us. This is crazy. Because actually it probably would be HHS that makes the decision. It wouldn't take legislation to change those dates, I don't believe. So, okay, and then just I'd like to keep you guys kind of in the news. You've probably heard a little bit more in the news about, just what's going on politically. We know that when we talked last time, we knew the results of the election. We know that we're going to have a new Congress coming up in 2015. So what are they up to? We already think and we hear that Speaker Boehner and Leader McConnell are soon to be, we think, right? Senate Majority Leader McConnell are already talking about things that they can do to help fix the ACA. Right away they were coming out with how can we work together and do some things that fix it. And we're hearing more now about repeal and replace. So just more to come. There's just all kinds of scuttlebutt. And I don't know about you guys, but I try to, especially when clients are involved, or even when I get a group of you guys, I really try to withhold because my opinions. But I really want to take a wait and see, and I think that's what we have to do. Is we do a wait and see. We know that the environment has changed, and we just don't know what's going to happen. We know that. I don't know. Don't you guys agree though? If they tried to repeal and replace, it'll be okay. It'll be a nightmare, right? Can we agree? It's going to be a nightmare, and it'll be our nightmare, and it'll especially be the health insurance company's nightmare. But this latest, two things pending that may be even more political, if you will, and more controversial, is not only the federal courts. We talked about this already, that they're going to be talking about the whole subsidy issue and whether or not Iowa, because we're a federally facilitated marketplace, whether we have rights to get subsidy for our folks in Iowa, because the law is pretty clear that that subsidy is for state-based exchanges. So remember, that's going to go, it's the Supreme Court has accepted that. They're going to be dealing with that. They probably already are. We hope they're ruling. We think their ruling will come out sometime this summer. That could have major implications on a lot of that. It's that trickle down like we talked about last month, because that could have everything to do with the, we'll call it the B penalty, on if an employer is supposed to offer coverage and they do, but it's not affordable or it's not minimum coverage, then they'll pay a penalty if people go into the exchange and get a subsidy. Well, there can't be a penalty if there's no subsidy, right? So there's those kinds of ramifications. But even more importantly than that, I think to stay tuned to, and maybe this is just a political stunt, but the House Republicans sue the administration over the ACA implementation. So, you know, both sides are going to play both sides of that. And did President Obama have the right to take executive order and delay and modify payments on how this goes to insurance companies? I don't know. And again, remember, folks, if you are an agent that represents Wellmark, Co-Opportunity, Coventry, we're trying to do, and I think the line that we take and that KHI takes, we're always here to try to do the best thing that we can for the client, serve the client in the current atmosphere, the current environment that we have to work with. And so we have to wait and see what happens. We can't do anything until we know that something has changed. So there's a lot of that talk and speculation going on right now. And as long as you are aware of it, and you can probably tell your employees the same thing I'm telling you, your employers and clients, tell them, we don't know anything and we can't adjust or react to anything until we know that something's been changed. Like if you like your health plan, you can keep it. We know as soon as that happened and the government came to the states and the states made their decision, we knew what that was. And that maybe positively impacted Wellmark and maybe negatively impacted Co-Opportunity, that delay, right? But it just is what it is. We're out there to serve our clients the best that we can, and I encourage you to kind of stay out of that political fray, but be knowledgeable of it, right? Okay, some more miscellaneous stuff. So just a quick update. If you have employer groups that are 50 plus and you have not engaged an ADP rep, and that's okay, maybe your group has found some other alternative. I'm telling you, we are having phenomenal success with our agents, employer groups, partnering with ADP and having ADP come in and help them from their time card collection to their payroll processing to their reporting for compliance for the Affordable Care Act. And so if you haven't, I would love for you to jump on and take advantage of that relationship. We've got additional discounts that have been negotiated for partners of KHI, any of our agents, as well, the complimentary diagnosis to go in and just see. It doesn't cost your group anything. So again, we're having great success. If you're not jumping into that, it's not too late. You know, get a hold of one of us, get a hold of me. I'll find out who your ADP rep is because they've got different reps all over the state. But again, we're just having some great success. Employers are thrilled with what's going on there. In fact, I think we're filming a testimonial, and we'll be sharing that with you guys so that if you want to use that with any of your employer groups to say, this has been great. Also, with health underwriters, I wanted to make sure that you knew, get these on your calendar, just a couple other dates. Some continuing ed programs again for those of you that would like to get the continuing ed credits, as well as just do some networking. January 14th, 15th, and 16th at Cedar Rapids, Des Moines, Storm Lake. 3 hours of ethics plus something on ERISA. But I know I need 1 hour, but I might as well go get 3, I'm telling you. So, and it's just good networking. You're in the know about what's going on with our organization and any other updates that we get, because usually we get an update, like a legislative update, and some great things happening there. And if you're not a member of Health Underwriters, I ask you to consider it. Get a hold of us get a hold of Misty at KHI, because we can get you at least a 3% discount. I think we're probably getting close to a 5% discount. The more agents that we can list bill, we pay the bill and we can get you a discount because we pay Health Underwriters one bill. So if you like that idea, then we can just accept a check from you, or we can take it monthly out of your commission check, whatever works for you. It's only $375 a year, you guys, and this is, you know, we've always said this. It's never been more important than now. So I won't say that because it's still important. How about that? It's still important that you consider that. There's our website to check it out for the state of Iowa. And then the Capitol Conference, if you've ever had that bug to say, you know what, I want to go to Washington, D.C., I want to be part of talking to our representatives about what in the heck is going on with my livelihood. Please let any of the board members know, let me know, course, Eric, Marcy, Dawn. I mean, get on our website. You'll see who our board of directors are. Talk to any of us. Jess is there as well. I mean, talk to Joe Evans, Greg Shireman. I know I'm missing some, but anyway, make sure that you get a hold of us if you're interested. And then I talked a little bit about the split contract, so I just want to wrap up with that comment I made earlier. And again, thanks to Brenda for bringing this up. I guess, you know what, our clients are looking for us. This is really individual market now I'm talking about, but our clients are looking to us to be creative, help them hold down costs of healthcare. So as you know, and many people are taking, if they qualify, we're pulling kids off and getting them on Hawkeye, that's great, or we're putting kids on their own standalone plan. We know the 0 to 18 or 0 to 20 rate rather, right, is one number. Depending on the plan, it's usually, you know, $100 or something around there. So if you've got, again, I'm going to remind you, no split contracts on anything other than an ACA plan. So you cannot take off dad off of a grandfathered or grandmothered plan and leave mom and the kids on that plan. So look at going to ACA plans, being able to split contracts, put dad on an HSA, mom on a copay plan, or vice versa. If mom's healthy and dad's got the medical issues and he needs to go to the doctor, do it opposite that. So just know that that's out there. So that was just a great reminder from Brenda to help us be creative and be competitive in the market. Whew, okay, I always try to leave time. That's just a little, we got about 12 or 13 minutes for questions. So let me go back out here to our folks, and this is where you guys can type in a question. You can raise your hand, and if you're on a telephone line, you can unmute yourself. I'll unmute you, and you can actually ask a live question, or please make a comment. This is a good time for sharing, too, because some people have other things that they've experienced, and it's great to get that sharing. Okay, so I've got some questions here. So coming from Allison, can you confirm, again, doesn't matter if the family premium is affordable on a group. Affordability goes by employee cost only, correct? And that is absolutely correct. And as you recall, initially they did come out with and said, in order to determine an employee's affordability, we're going to look at household income, blah, 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 and everybody went up in arms. How are we supposed to know? And the employer even said that. How are we supposed to know what household income is? So they came in with another safe harbor and said, okay, or you can take that employee's adjusted gross income and just use that employee's income and the employee plan. So we're going to take, and this is where many employers are saying, hey, I'm just going to slam in there and offer a bronze whatever, maybe even a bronze HSA as their what I'll call their lowest affordability option. As you know, bronze would be the lowest that they could offer, or on a larger group at 60% actuarial value. But yeah, so they threw in a bronze, and then they take that premium, and they make sure that whether they've used the premium at the age rate, when it's the under 50 and under, or if they've done composite rates, right? We need to make sure that that employee does not pay any more than, in 2015, it's 9.56% of their own adjusted gross income against a single plan, not employee. So I think I confirmed that, Allison. Thank you for the question. The next one is, Lynn, if the employer treats the reimbursement for an individual plan as wages, are they all still okay? So if the employer treats the reimbursement for an individual plan as wages, are they still okay? And I know it looks like maybe Frank has left, but I want to answer this question because in that same email that I was talking about that I got from Dietrich at Advantage Administrators, it says even if somebody is intentionally increasing their wages specifically to cover the reimbursement, they're not in compliance. So they just want to avoid the whole reimbursement thing. They have to offer a group plan. So there it is. And then when you're on a group plan with a cafeteria plan, so you've got a group chassis, we're going to call it, with a cafeteria plan, and this is where Advantage Administrators is so valuable. I'll say it again. It'll help keep your employer group compliant. And again, if you're not using them, then use another TPA, but use one that's got the ethics and the convictions to do things by the law and by the book. And then we stay out of trouble because there are TPAs out there that are given the wrong information. So it's not okay to just reimburse with the sole intent to be able to reimburse those individual policies. Okay, offer a group plan. That's what they need to do. And okay, all right. So health underwriters. Oh, thank you, Marcy. We changed the dates in January for the ethics and ERISA. Cedar Rapids will be on the 15th, Storm Lake on the 16th, and Des Moines on the 23rd. Okay, so Storm Lake and Des Moines on the 16th. Okay, I had them wrong. So thank you. We'll check out the website. Marcy says it'll be updated and registration will be open next week. And we do have a new website there. It's kind of nice where you can actually enroll or register rather right on the site. In the past, we had to send emails and get registered that way. And so this is so much easier. So please, I'll just drive you to our website that I talked about earlier and verify those. Thank you very much. Okay, another question here from Marcia. Can we AOR Wellmark individual plans all year long? Yes. Yes. So get them in by the 10th of any month for the first of the month following. And I'll add on to Marcia's question. Not only can we AOR Wellmark individual plans, but we can also AOR away from direct Wellmark business. We know that many of our clients went online, and maybe we even guided them, and we didn't know, and it ended up being Wellmark house business. And they've come to you still. They have your other products from you, and now they're direct with Wellmark, and you still service them. So it can come direct from Wellmark. Just make sure that what we don't want to see is somebody spending all their time just chasing business to AOR it away. Wellmark says if I see a pattern of agents going out and AORing blocks of business from here to there, they're going to shut it down. So, but you can AOR individual plans all year long, including Wellmark direct business that up to this point had always been hands-off. I will say this too, we are allowed to AOR Farm Bureau business. Again, don't do the whole, I'm going after one particular Farm Bureau agent's med sup block and I'm taking it all. It can only, by the way, you can only AOR when a Farm Bureau agent, obviously not the Farm Bureau plans, because the Farm Bureau plans are, many of their plans are unique. Some of their ACA plans are now the same as our ACA plans. So if you're doing an ACA to ACA, Farm Bureau, that's okay. But if you're going to go from Farm Bureau unique plan or non-ACA to an ACA, of course, that is not an AOR. You got to write a new policy for that, right? So anyway, so just yeah, good stuff happening on AORs, and I suggest you keep a pile of those papers, make those copies, and get them on your desk and put them in a folder and leave it right on your desk, AOR, so you don't forget when that client comes in. You said, oh, by the way, I noticed, right? So one of the things, too, that we can help you with is we could run you a list of all your Part Ds where you don't have the med sup. How about that, right? And I think some of those we've sent out already. So, but anyway, good stuff. Thank you, Marcia. Let's see. And, oh, it sounds like just Marcy's comment, sorry, Troy, one of our presenters for the ethics, had a scheduling conflict, so we're trying to accommodate him. So we apologize for the change in the dates on the health underwriters meetings. Let's see. And then I guess Paul just has a question. Looks like he had to leave as well. But Paul says, it took me 4 hours to help re-enroll a client yesterday on healthcare.gov. I say thank you for sharing, and it's unfortunate because this is exactly what we've been hearing, and I think that's why some of you are going to have some late nights tonight. You'll be working this weekend and have a long day on Monday. That's unfortunate. Okay, here's another question / comment by Carol. Thank you, Carol. It says, I have an under 65 disabled person which was eligible for Medicare in August of 2014. We started him on a Medicare Advantage plan and a PDP plan effective 8/1/14. Okay, so he must have either a Medicare Advantage that does not offer drug coverage and a standalone PDP plan, because a lot of times you'll get the Med Advantage that has drug in it, but if you started him on a Medicare Advantage plan that was no drug in it, and then you sold him or enrolled him in a standalone PDP plan, that's fine. Now, I'm just going to read on here. So he just found out he has a major medical condition. Can we disenroll him from Medicare Advantage back to original Medicare and get a Medicare supplement without question, since we're still within the 6 months of receiving the Part B coverage? You normally would if they were already 65, but That's a great question. You know what? And I'm going to have to table that one because we know that if they're still within their open enrollment for age 65, but here's my answer to that question, and then I will confirm, and I'll have anybody else chime in that's on the call. But think about this. When they first enrolled, they didn't have to answer the health questions, right? But now they're within their first 12 months of having a Medicare Advantage plan. Does that give them the right, guaranteed issue right, to get a Medicare supplement without health questions when they should have answered them in the first place, right? So it's crazy, and I hear exactly what you're saying because this question was posed and I never did get an answer. So let's just play this just one more time. So now you're going to go, let's say you go online and you're going to answer the Medicare questions on, let's just use Wellmark as an example. You go to Wellmark's site. There's a whole bunch of questions like, I had a Medicare Advantage plan and I'm within my 12-month trial and I want out. I believe that will give them a special enrollment period and to get their D, of course, but also give them a supplement without having to answer the health questions. But here's what I'd ask you to do, because the only way that we can get an answer other than asking Wellmark is actually go through the app. Click through that far into the application for a MedSup and see if it gives you that. It'll tell you, you now get a special enrollment period and no health questions. So actually do that, all right? And then let's talk afterwards. That was Carol Weber. Carol, get back to me. Let's you and I connect up yet today, okay? But go further into that application as if you're taking the app on that MedSup client and see what that does when you use that special enrollment period. And I think it might give you that without having to answer the health questions, which is so interesting because we know we've got folks, all of us know people on disability that can't answer the health questions, and they took a Med Advantage. So have it for a month, or in this case, a few months, and then get back, and now you get a Medicare supplement without having to answer the health questions. And I'm sure that wasn't the intent, but it could be a loophole, right? So, Carol, you check that out if you would. Go further in that application, and let's talk afterwards. Wow, great question. It'd be awesome for the client if that would work, right? It just meant they had to be on a Medicare Advantage for at least a month. In your case, they've been on longer than that. Let's see. To clarify, this is Donna Fields. To clarify, you can't do an AOR on individual Farm Bureau and they keep their existing plan. If it's a Farm Bureau, see, in the olden days, right, before ACA, Farm Bureau had their own unique plans. When ACA came out, Farm Bureau offered their own unique ACA plans and plans that are identical to ours on the what we call the direct pay or the independent agent market, right? So it depends. You have to find out what kind of Farm Bureau individual policy they have. If it's an Affordable Care Act policy just like we have, then they won't need to change their plan. We can AOR it, and they won't change their plan. Now remember, Wellmark is going to kind of want to know why. And they're concerned about, again, about agents like us going after a Farm Bureau block and just moving it. If the agent retired, if there's nobody there in that market anymore, if they're not really into health care insurance anymore, put that reason down. It's probably not willy-nilly that they're going to allow these, but they will allow it, again, if it's right to serve the client. So if it's an old Farm Bureau policy that you can't sell, and you'll know because you'll look at the policy or they'll tell you what it is and you go, I have no idea what a Farm Bureau Gold is, right? And that's not gold as in metallic gold for ACA. It's a non-ACA plan and it's called a gold. We don't have that plan. You're going to have to rewrite them to a new ACA plan and still get the agent of record form signed because they need to be aware they are losing their old Farm Bureau coverage, buying new, and moving to you as the agent, okay? So, Donna, I hope that answered your question. Thank you for that. Another question. If the individual is in their first year of a Medicare Advantage, they can get a supplement without medical questions. And then you have on here, keep their current prescription drug plan. Okay, let me just clarify because now if that means Marcia, and I want you to put another comment in here, but especially if you're talking about the under 65, these are the folks that are on Medicare due to disability and they're not 65. They have to answer the health questions in order to get a SUP. I had an agent just ask me this the other day, and I said, if your client cannot answer the health questions, let's say they've just been in the hospital, go through those health questions on the MedSup app. They've been in the hospital within the last 90 days, or whatever the case is, those key questions at the beginning. If they can't answer those and they go to a Medicare Advantage, Carol Weber's question was, can we get a SUP back and not answer health questions? Because you see, that's kind of a loophole. You're getting around the whole nature of forcing those under 65 to answer health questions. Now, I also want to make one more comment. Remember, on a Medicare Advantage plan, at least the Coventry plan that I have most experience with, the Coventry Med Advantage, it has built-in drug coverage in it. So when you terminate the Medicare Advantage plan, you're losing your Part D drug coverage also. Within the 12 months of anybody having a Med Advantage, they get a special enrollment period to get their D. The question is really all around to get that supplement back, because they're still in their initial 6-month open enrollment period to get their B. Do they have to answer health questions? And my comment is, if they're on disability, they had to answer health questions before, they should have to answer them again. If you're still within your open enrollment above the age of 65 and you don't have to answer health questions, then you don't have to answer health questions. You know what I'm saying? So that's the loophole that I want to get clarification on. So, so we'll find out, and Carol and I will get back. So yes, but you're right, Marcia. If they had a Med Advantage that did not have prescription drug in it, and they had their own standalone prescription drug plan, they get out of the Medicare Advantage plan, buy a SUP, and they could keep that standalone RX coverage. But it also gives them a special enrollment period if they want to change to a different RX coverage. All right. All right, I think I got through all of the questions that I saw. You guys are awesome. Looking to see if I have any more or hand raised or any more questions. And I'm starting to lose you guys because I know we're 10 o'clock and you've got other commitments. So let me just wrap here and say thank you again. Thank you for your business. Thank you for your support on this call. And thank you for your commitment to stay on top of all this stuff and commit to being the best that you can be in our industry. Because I'm convinced now more than ever, and I've been saying this for 2 years, you either commit to get in this business or get out. If you get out, partner with somebody. Partner with KHI, partner with another agent. I talked about our Premier Agent program we're developing so that we can match you up with another awesome KHI agent and you guys can negotiate and split some deals. I'm telling you, you either commit to this business and you run with it or you get out of this business. So anyway, thank you because you're on this call. You guys are committed. And more to come on the Premier Agent program in case you're interested in partnering with other agents that don't want to do this anymore, just don't have the capacity to do it. And it looks like we got one more question. Thank you, Allison Mercer. I'm going to answer it. What if the individual under 65 has Medicare and is losing group coverage? Health questions still apply. If they're under 65, they're on Medicare, and they're losing their group coverage, I'm telling you, Allison, that's still my understanding, that they have to answer the health questions in an under 65 application. So I will get clarification, and I'll get back to Allison, you on that. I'll let my staff know, too. So if you guys call in, we'll have the definite answer on that. But before I say definitely one way or another, I'm going to confirm that, Allison. Okay? So we've got the issue on losing group coverage or flat out they're in Medicare Advantage and they want to come back to us up. Do they have to answer the health questions when they're under 65? I'm pretty sure the answer is yes. But we'll confirm that. All right. You bet. Everybody have a wonderful weekend. Good luck getting through everything. As always, call us if you need anything. And thanks again for your business and your support. Take care. Have a great day and great weekend. Bye.